My name is Holly Faley, and I'm going to share a little bit about my ketamine story. Going back about 5 years, I was in nursing school, and after I graduated nursing school, I became a nurse at the University of Iowa Children's Hospital. And about a year into working at the pediatric ICU, my younger sister Hope passed away in October of 2024. I took some time off of work to try to start healing from this. And as I went back to work, I quickly realized that I could not be surrounded by this type of grief while I was still experiencing my own. I tried conventional therapy, so I tried talk therapy for a little bit, and honestly, it just did not work for me. After a couple sessions of traditional talk therapy, I decided to step away from that. I was able to chat with Stephanie about my story, and she had asked me what therapies I'd tried. I discussed that I had tried talking therapy, and it did not work for me. I hated it it just wasn't for me. And so Stephanie offered ketamine therapy and talked about how it can be paired with Reiki, a spiritual healing. And I was at a point in my life where I was ready to try anything that would get me out of this super dark hole that I was in.
What really got me interested in doing ketamine was I had a lot of complex illness patients, and we were doing all of those things on the physical level, but there was something that was limiting them from their full healing. And when we really got down deep, it was the emotional layers that weren't healed. My first patient ever was someone that I had for many years, and she had complex pain syndrome from Lyme. And she had a 9-year-old son at the time, and she wasn't able to push her foot down and play the drums with her son. And after the first ketamine session, she went home and she was able to ride a bike, and she was able to play drums for the first time in many years.
You're laying on the bed, you have an eye mask on, there's an audio playing, and I just remember fully feeling like I'm floating out of my body, but fully aware of where my body was, that my body was safe, and that the energy in the room was safe and healing. Right at the point where I thought maybe I would be a little weary of not being in my body anymore, I felt my sister's presence come to, and she just blanketed me in calm and peace, and I knew I was safe.
How ketamine works in the body is that it releases brain-derived neurotropic factor, BDNF, and with that, that's how it does reconnections of neurosynapses in the body. So the brain has these connections that maybe get shortened, or just with age, they're not as strong, and especially with traumatic experiences or things like that. So what ketamine does is releases that factor, and that helps open those pathways, create new neural pathways, and really help people heal. So what I love most about it is that it's not just a Band-Aid, it's truly helping heal from the synaptic level.
I often say that this ketamine and Reiki therapy saved my life. I was at a point where there was no light at the end of the tunnel. I was very much depressed. I had so much anxiety. I had so much anger, so much unresolved. When someone passes away prematurely and as abruptly as my sister did, there's a lot of questions and there's a lot of anger that comes with that. And ketamine gave me that light at the end of the tunnel. Through my sessions, I was able to have closure with my sister. Through especially the Reiki aspect, I was able to communicate with her. And I think because the day of her death was so traumatic and abrupt, being able to hear from her that she felt no pain, that she saw Jesus's face as soon as she passed, gave me this overwhelming sense of comfort that she was safe and happy, which is all I wanted.
I begin the session just like I do any Reiki session. So we set the tone, we set the mood, and I start it like that, and then I start feeling the body as the person is starting to relax and go into their journey, and then I become their support person. So energetically, emotionally, I'm feeling their body, feeling their energy. I'm also receiving messages as it's going along. So I'm receiving messages from Spirit, from God, from their loved ones that have passed, and then I'm writing notes or I'm drawing pictures, whatever is necessary or whatever I'm intuitively called to do. Every session is special for that person, and it's never the same, and it's always incredible.
With Abby, she's holding space Energetic wise, she's listening to the body and its tune and seeing like what feels off, what needs to be adjusted. And maybe she has some messages that come through that can just be helpful for the patient as they heal. And then afterwards, when we come together and we talk about the session, it's just like having two therapists in a room. We're really able to bring different perspectives from our experiences, which is really healing for the patient.
Anybody who's thinking about ketamine, who has had a thought that maybe it would be worth a shot, it is. I am a testament that it can completely change your life.